Hi, I'm Tracy, OCRA's oncology social worker. I want to reach out and talk with you directly. We've been receiving, many emails and calls about how to manage COVID-19 coronavirus and ovarian cancer. I thought it might be helpful to answer your questions and share some helpful strategies to get through these unprecedented times. As I'm sure you've seen in the media and heard through your physicians, there is the critical importance of self-quarantine, social distancing, washing your hands, not touching your face. And, we recognize that these are some of the same recommendations that you probably received when you first started treatment. And so this is really something that's familiar and something you can do, and you can be successful at it. Each treatment team is going to offer you a plan for your safety, a safety for others, and to ensure continued access to care. And I think it's really most important to speak to your team, your physician, and maintain that patient-provider contact at all times. Communication is so critical. Access to care is not going to decrease. You're going to be able to see your physicians and receive the treatment you need. There may be some changes to your process and protocol, some of which, and not consistently, but some of which may be decreasing the number of care team members that you physically see. Some of the contacts you may now have will be either by phone or through the hospital portal or even by email, but communication will continue. Some well visits may be conducted now through telehealth and telemedicine, which is online and in some ways, interactive, but like this videotape that I'm making now. If you are receiving treatment, some treatment centers are asking for no visitors to join you, just to maintain their safety, your safety, the safety of other patients, and the safety of the staff. Ultimately, hospitals and cancer programs are agile. They can be flexible, and they really can create very quickly new protocols to ensure your safety comes first. There is no doubt that every team is focused on what they can do to ensure that you are protected, during what most people are calling the healthcare challenge of our generation. This is an unprecedented virus, and it's important for us to prepare and care for ourselves. And there's many reactions when facing a trauma like this, and especially after, dealing with the real trauma of a diagnosis of ovarian or gynecologic cancer. And there are many normal reactions that can feel really out of control. A normal reaction can be fear, a sense of hyper alertness, feeling isolated, especially when we're asking for you to self-isolate at home and to self-quarantine, not self-isolate. And feelings of being overwhelmed, there's some real sense of anger and frustration. And, trauma and these unprecedented times can also manifest in physical and emotional symptoms. So these are uncertain times, and it's important to be aware of your feelings, create a safety plan for yourself, take care of yourself, and take care of your loved ones. So again, communication with your team, and please know that you're not alone. Some concrete ideas to help, and that can be helpful, are maintaining a sense of routine or creating a new routine so that each day feels familiar and that you have a plan. I would highly recommend limiting your exposure to news, to your screen time, to phone. Obviously, you want critical information, but this is very overwhelming, hearing many of these very difficult messages repeatedly throughout the day. So spend time taking a walk, sitting outside, just breathing the air. Obviously, we're talking about being outside and practicing social distancing, which involves being 6 feet away or more from others, coming in and washing your hands. But, exercise without overdoing it can be incredibly helpful. Breathing can be incredibly supportive. Planting. It's springtime, and springtime can enhance a feeling of hopeful renewal. So this is a great time to get out there and weed your yard and, get focused on doing something that can feel productive. And, meditation, relaxation, taking calming breaths. There's a great app. It's called the Calm app that you may find helpful. And OCRA is publishing some resources that you will find that also could be very helpful in terms of meditation and connectedness. One of the things I'm doing is teaching my dog a new trick each week. It's giving me a sense of an activity and something I feel like I can accomplish and feel good about. I think it's so important to take care of yourself and to be kind to yourself. Have patience, maintain a sense of humor, find avenues of fun. I have one of our woman-to-woman mentors suggested watching old movies or the Hallmark Channel or reading a book that always has a happy ending. These are all really constructive ideas that can put a positive face and help you feel a little bit better. So finding avenues of fun and, ensuring that you remain hope-filled and flexible. There's a true value in support and connectedness. But if you have a sense that, what I'm describing, you have more of a sense of a persistent feeling of distress or hopelessness, it may be time for you to seek professional help. Speak to your team. Seek out mental health. Again, in the resources that OCRA is going to provide, you will find some good communities and contacts for mental health care, even if it's remote mental health care. Just please take care of yourselves. And know that OCRA is always going to be here. We are really committed to ensuring that we have a community, that we provide information and support, and that this community, which continues to grow, is available and for you and for others. So please be aware of our patient support line. You'll hear from me directly on that, and the number is 212-268-1002. I can help you navigate resources or just talk through what you're going through, link you to mental health providers locally, or connect you to some of our other programs. We have an online community. It's robust, it's encouraging, it's really a wonderful group of people, and it's through Inspire. So you join, if you haven't joined already, it's www.inspire.com. You'll set up a profile and join the ovarian cancer community. You can post or you can read, and you can really connect with many, many people, all times of day and night. And it's a lovely, lovely community. I highly recommend it. People share ideas and support. It's really a fantastic group. And we also have a tremendous woman-to-woman network. It is a group of dedicated, trained peer mentors across the country who can offer support and guidance and connectedness in a way that no one else can. They've been there, they get it, and they are really available for you. And I have to say, it's the most wonderful group of people who really want to be available to you. So please consider asking for a woman-to-woman mentor and getting connected. Again, the easiest way to be connected to a mentor is to call me directly, 212-268-1002. We're going to keep trying to do this and bring these messages along. And if you have any other ideas of how to stay connected, please reach out. We want to hear from you. We want you to take care of yourself and your loved ones. You're not alone. And the OCRA community is strong. We're resilient. And we are here for you. So please stay safe and stay in touch. Bye. Be well.